All right. Well, good evening. Thank you for joining us to learn about the University of Medicine and Health Sciences, or UMHS. My name is Sean Powers. I'm Vice President for Admissions at UMHS, and my colleagues and I, we appreciate the opportunity to share information about UMHS with you. Along with me, as always, my colleague, Sham Daria, Director of Enrollment Management. He's pushing the buttons, pulling the levers behind the scenes to make us all look good this evening. So we appreciate you taking some time out of your schedule to join us to learn a little bit about the university. And before I introduce our panelists, I just want to note that if you have not yet applied for admission to UMHS, applications are still being accepted and processed for the remaining entry terms in 2025, and that's May and September. And if your plan had been to start medical school last September and you were not given the opportunity to do that, or if your plan had been to start medical school this coming September and you recently learned that you won't have the opportunity to do that, talk to us. We may still be able to provide that opportunity for you as soon as this May. Again, we are accepting applications not only for this spring, for this fall as well. So that said, we're going to give you a lot of information about the university this evening. We have a lot to talk about. So I want to begin by introducing the panelists that we have here to help us talk about the university. First, we have Dr. Craig Eyre. Dr. Eyre is our Assistant Dean of Student Affairs. He's also Associate Professor of Molecular Sciences at our Basic Science campus in St. Kitts. And he also holds the title of Chair of the Research Program at UMHS. Thanks for joining us this evening, Dr. Eyre.
Hi, thanks, Sean. Good evening, everybody. Thanks for taking your time out to join us today. So I'm happy to answer any questions you might have about the university. I'll talk to you a bit about our curriculum and what life is like down on St. Kitts. So a little bit about me. I'm a Canadian. I'm on the East Coast, living part of the year in New Brunswick when I'm not down in St. Kitts. So I am one of the professors in the molecular sciences. I'm an immunologist by training who sort of sideways landed into genetics after that. So you see me in 3 or 4 of the courses in molecular sciences when you come down with us to the island. So again, thanks for joining us here this evening, and I'm happy to talk to you about the university.
Thank you so much, Dr. Eyre. You'll be covering things, as you mentioned, from the faculty and the administrative side. And then, of course, you'll want to hear from the student or alumni side as well. And covering that angle for us, we have Dr. Holly Workus. Dr. Workus is double board certified. She's in internal medicine and hospice and palliative care. It's a mouthful. As you can see, a palliative care attending physician at Ascension St. John's in Detroit. Graduated from UMHS back in 2017. It seems like yesterday, Holly, but it's good to see you.
Thank you. Yeah, I'm really excited to be here. A little bit about me, I'm from Michigan originally, and I did the extended basic science program down in St. Kitts. I graduated in 2017 and I matched in internal medicine residency in Chicago. And then following my residency, I went directly into fellowship at Vanderbilt University in Nashville, where I did a fellowship in hospice and palliative medicine. Currently, I am working full-time as a palliative care physician. On the inpatient and outpatient side, I do have 1 day of clinic a week. I also work for a hospice company where I'm doing on-call from home, around 240 hours a month. And then I am the owner and founder of an aesthetics company where I do Botox and filler. Also, in my spare time, I'm the vice president of the alumni committee for UMHS. So I'm really focused on keeping all of our students connected because we've come from all over, but we do have a very strong alumni group, and I'm really excited to be here today.
Thanks so much, Holly. Thanks for joining us, taking time out of what we know is a very, very busy schedule. So what are we going to talk about this evening with Dr. Workus and Dr. Eyre and others? Well, we're going to be talking about UMHS, giving a full overview, as Dr. Eyre mentioned, talking about things from the faculty perspective as well as the student perspective. We'll be covering information about life in St. Kitts, where our basic science campus is located. We'll be talking about the 5th semester, where you progress after completing the basic sciences and how that prepares you for the second half of your medical education, which also includes preparing for the all-important licensing exams. And then the second half of that medical education, your clinical clerkships and rotations, and all of that work that gets you ready for what it is ultimately that you are hoping to do, which is practice medicine with an MD after your name. So we'll be talking about those outcomes and residency results And after we've gone through all of that, you'll really have two main questions. And those questions will be, okay, well, how do I get in? And then how do I pay for it? And we will cover those questions certainly as well. But as you've likely noticed, this title of the presentation this evening is our President's Webinar, and certainly we could not do it without our President. So it gives me great pleasure at this point to welcome in our President of UMHS and the founder of the university, Warren Ross. Good evening, President Ross. Good to see you.
Hi, good to see everybody on this call. I'm really happy to be here tonight, and I love talking about our university, our goals, our vision, our views. But it's really nice to kind of go back historically and look at where we've been, what my background was and experience, and how we came to create UMHS. So I'll take you back to 1978 when my dad and I first established one of the first Caribbean medical schools at the time, called Ross University. And over many years, we grew it into one of the largest offshore medical schools with multiple affiliations with teaching hospitals, recognition by the U.S. Department of Education, state-of-the-art facilities, graduates that are licensed and practicing throughout the United States. And we learned a whole lot during those years that we ran UMHS, but it was run more as a family organization. We had a lot of caring and dedication to our students. And what happened was, when my dad got into his 80s, he decided it was time to retire. So he sold Ross University. Um, but we kind of kept an eye on what was going on in the Caribbean. We had a passion and love for what we did, and we really were dedicated to providing students with the best education possible. And we found that many of the Caribbean schools were developed or were being bought up by Wall Street type people, and there were more dedicated to how many students that they could bring in, and they were bringing in as many as 300, 400, 500 students a semester. The quality of education, in our view, started to decline, and students weren't getting the same type of education that they received under our leadership. So my dad said to me, we're going to start another medical school, but this time we're going to build to a U.S. standard. It's not going to be built as a Caribbean medical school in every way, in every aspect. We were very cognizant of what the type of programs that were established in the United States, and we wanted to make sure that we were following LCME standards, Liaison Committee on Medical Education, in terms of the development of the academic facilities, the type of faculty that we recruit, the resources that we provide to the students. Virtually every aspect of the university was geared towards developing what we view as a U.S. medical school in the Caribbean. So what we wanted to do is give students an alternative to these very large institutions that were there, where you have limited resources, where your student to faculty ratio is not comparable to what you would expect in the U.S. In a U.S. system, where the standard is a 8-to-1 student faculty ratio. Our standard is 7-to-1 student faculty ratio, which is even better, which means that we have dedicated faculty and the resources to ensure that you have the mentoring, the tutoring, the advising that is necessary throughout the academic program. And we wanted to make sure that the facilities that we built were comparable to what you would expect at a U.S. school. But the most important part of what we did in terms of an alternative, what really sets apart from other schools, is by bringing in smaller classes. We don't bring in 300, 400, 500 students a semester. And it's a much smaller kind of boutique, where there's hands-on personalized education, which to me is really important part of an academic program. And it's what you would expect if you went to a U.S. medical school. You want the hands-on personalized approach. And that's exactly what we achieved. And so it really sets us apart from all the other institutions that are in the Caribbean. And given that factor, we wanted to build these facilities, not only the multi-purpose lab, the classrooms, the auditorium, the anatomy lab, the skills lab, the fiber optic backbones, the audiovisual technology, the utilization of computers in all the classrooms. It really is one of the most state-of-the-art medical schools in the Caribbean. And I've been building in the Caribbean since 1978. I've visited virtually all the top tiered schools down there. I know exactly what they have, and I know what exactly we have. And I know what we have is comparable. And we've tested that because we're accredited by ACCM, which is a body out of Ireland that accredits medical schools, and it has adopted the LCME standards of accreditation. And LCME is the group that actually accredits U.S. medical schools. And they have deemed us to be comparable and equivalent in every aspect, in every way that you could recognize. In fact, the last review that we had, which was in 2024, we had 0 sites. Which is unheard of for any medical school, whether you're Caribbean or U.S. medical school, which means that we met every standard that the accreditors had, and it was proof and evidence of the quality of the education, and that we have followed the U.S. standards, and that our graduates, when they go off apply for residency, they can show they can be proud that they have graduated such an accomplished quality academic program. And we've proven to the world, not only to all the residency directors, but to the world, how good of an institution that we really have. So we are recognized. We have state-of-the-art facilities, but also the important part is finding dedicated faculty that are dedicated to your success. So in a small school environment, there is research, but they're also fully dedicated to you. So they mentor, they tutor, they have office hours, they work with you diligently throughout the course of the semester, and they have a curriculum that's comparable to what you would have at the U.S. medical school. And we've incorporated throughout the basic science program quizzes that are USMLE style questions. So that all the way through the basic sciences, you have USMLE style questions, both in quizzes, block examinations, and then we've introduced National Board of Medical Examiner questions throughout the basic science program, so that all the way through, you're ultimately preparing for USMLE Step 1. And then recently, we not only do we have an affiliation with Kaplan Medical, which we've had for many years, so you have full access to all the Kaplan material starting day 1, but we are now affiliating with UWorld, and we're incorporating UWorld into our review program, which is in our 5th semester in Maine. But we're also now developing a review program in our last semester in St. Kitts. So you'll be working with our faculty to review all the material to prepare you for USMLE while you're still in St. Kitts, full access to UWorld questions, which will also be incorporated into all the classrooms and lectures. And so, if UWorld is the premier review program in the United States in terms of question banks. It's considered the Rolls-Royce of question banks. So all the way through the basic sciences, you're working with dedicated faculty that are recruited primarily because they have experience. They experience for teaching at U.S. Canadian or other international medical schools. They are appropriately credentials. They have either their PhD and or MD degrees. And when we hire faculty, and this is an important part, I'm a believer in student input, and we don't hire anyone without their input. So every faculty member that applies for a position, they're required to come down, give a lecture, meet with the students, and they are reviewed by both their peers as well as the students. And unless the student as a group approves of this candidate, we won't hire that person. So you're an integral part of the institution, and your feedback through various groups like the Student Government Association is so critical, because we listen to what you have to say. We listen to your recommendations, your suggestions for improvement, and we make those improvements. And I'll give you an example of that. We recently did a survey, and the students overwhelmingly said we should incorporate UWorld into our review program in Maine, where we've developed a 15-week review program. They also said that we need to incorporate NBME self-assessments throughout the program. And they also recommended using CBSE as a final examination, which is created by the National Board of Medical Examiners. So we've integrated all that now into a new 15-week review program utilizing Kaplan for the didactic lectures, utilizing UWorld questions with small groups, utilizing our faculty from St. Kitts as mentors, and incorporating NBME self-assessments into the review, which I will have to tell you, there is no medical school in the Caribbean that is offering this type of review program. In my estimation, in my view, there is not a better review program students are going to get to prepare them for USMLE. So I've done a lot of talking so far. Craig, maybe you can talk a little bit about St. Kitts, the faculty, the caliber and quality of the faculty, and maybe our kind of our early detection program, so that after each block examination, students that are at risk are required to meet with the faculty, develop a plan of action, and to continue to mentor and work with them, in addition to utilizing our team of learning specialists to continue to work for the students all the way through from semester 1 until they complete the basic sciences.
Yeah, thanks. I would be happy to. So let's go through just a little bit of the ins and outs about what it means to be a faculty member at UMHS and what it's like on the island. So as President Ross said, the first and most important thing to us is that the faculty that we have are high quality, impeccably credentialed, and accessible. Those are the three things that would really define what it means to be a faculty member for us. So let's start with our student faculty ratio. So 8-to-1, 7-to-1 is the area that we're looking at here. So that's what UMHS has as its mandate. So comparable to US medical schools. What does that mean? First, it means you get FaceTime with your faculty members. You're not simply an anonymous individual in the class. You're not just somebody who's hanging out in the back. You get to know us, we get to know you. And that's actually essential to success in a medical program, okay? So from what that means from a faculty perspective, if you look at the US averages, a faculty member usually teaches somewhere between 3 and 6 credit hours per semester. Okay, so that's roughly what we're doing. That means 3 to 6 hours of contact with students per week. That's it. Okay, so on average, I teach about 3 times that level. And that's true for all the faculty members that are at UMHS. So you get us significantly more than you are even familiar with through your own undergraduate or graduate programs, or what you could expect from a US medical school. That's an enormous driver for student success, because it means there's no point where you're left to sink or swim. Because you have access to us, you get real-time feedback. You get immediate correction. You get personalized guidance. So I want you to think about the curriculum for medical school in a different way. We're all familiar with undergrad. Okay, we know what it means to sit in a lecture classroom, absorb some facts, spit them back out. That's not what medicine is. So you've got to put that to one side. What medicine is more like an apprenticeship. Okay, so the basic sciences, even though it might feel like you're back in your undergrad sometimes, it's an apprenticeship. We're training you to become physicians. It's a training, not just about knowledge. Okay, so the only way to get good training is by having accessible role models, and that's what we strive to be. That's what UMHS is founded on. It's that relationship between faculty and students. So every faculty member that's at UMHS has got their terminal degree. So that means a PhD and an MD or an MD or an equivalent degree. So for example, if you graduated from the UK, you might have an MBBS. So we have all terminal degrees. In most graduate programs, you're taught by other graduate students. So that means you're getting a higher quality of instruction. On top of that, our faculty members are all specialists in some area. So like we said off the beginning of the webinar, I'm an immunologist. And so I anchor about 70% of the immunology course and about 70% of the genetics course. That's my specialty. So I'm trained in diagnostic medicine. Before I came to UMHS, I worked in a hospital for doing diagnostics for oncology. So what do I teach? I teach how to do those diagnostics. I teach how the immune system works in healthy individuals and individuals who have different types of diseases. I teach how genetics is used for personalized medicine. So all of that is quite literally the forefront of medicine right now because that's what's being practiced in hospitals. So what do I get to teach at UMHS? Exactly that. Every faculty member has the same story. So you have individuals who come down with expertise in pathology, in histology, in biochemistry. All of these courses are anchored by faculty members who are specialist experts in those areas. All of our courses are team taught. So that means there's at least 2 faculty members who are in the course with you who are providing guidance in different areas, who get to tag team on their specialties. So you always get the highest level of instruction that you can get. That is an enormous success story. So to give you an example of the curriculum here, these are the courses that are through our basic sciences. This is what you do on St. Kitts. And you can see in semester 1 through semester 4, we start off with the body as sort of a big picture. How is the human body put together? How do your cells work? How do we do basic physician skills like make examinations and diagnoses? As you get into semester 2 and 3, we start moving into specialty topic areas. So biochemistry, how do you turn food into fuel? How do you build different components? How do your enzymes work? Genetics, immunology, epidemiology, and physiology. These are all anchor courses about how health decisions are made and how the human body works. As you get into the later semesters, like semester 4, is where we start looking at put it all together and let's start talking about the context of human health from all of these specialties as a combined total. So by the time you're finishing that semester 4 in the 4-semester program or the equivalent in the 5-semester program, you've seen all of these areas of health and biology from these specialists with hands-on, high levels of contact. Okay, so that's incomparable anywhere else. I challenge you to look at any other school's construction and find people who will give the same level of hands-on time with you. But wait, there's more. So that's just the classroom time. Then we start looking at how we personalize instruction for you. So I hold office hours every day. Every faculty member holds office hours every day. They're accessible to all students. It doesn't even matter if they're registered for your class, but it means that there's one-on-one FaceTime available every day with every professor. That's a mandatory. All professors are also assigned 20 students who are their individual mentees for the semester. And usually you stay with your faculty mentor all the way through the basic sciences program. And so that means you get continual check-ins from the same faculty member who can provide you guidance on study skills, test-taking strategies, give you some perspectives on things like, hey, when I leave from here, how do I get letters of recommendation? Or I've got questions that are affecting my time on my island, my life on island. How do I deal with this form? Where do I go to find these things? You have a faculty member who's dedicated to you exclusively with the idea of being your mentor. So if you have a question and you don't know how to get that answer, they're accessible to you with the resources to find that answer for you. So that's just from the faculty side of it. On top of that, we maintain a peer tutoring network and our TA program. So every upper class individual is able to tutor the courses that they have already completed as long as their GPA and their grades are high enough in these classes. So peer tutorials are an excellent way of first, not just developing your own skills because, hey, medicine is a communication art. You're going to spend your entire career talking with your patients, their families. So developing that skill early in med school is of enormous success to you. But it also helps when you have people who are at your level who can say, hey, I went through this last semester. Here's what really works for me. Here's the pitfalls that we find. Or, hey, listen, let's call a spade a spade. These are people who went through, for example, my class. They're going to look at you and they're going to say, Air really loves to ask this style of question. Well, why does he? Because that's going to show up on the USMLE. So make sure you know how to do that. Those are individuals who can really let you peek behind the curtain. So all of this network is built into your time on island from your curriculum perspective. We have dedicated learning specialists, an entire team actually of learning specialists whose only job on the island is to help to develop your study skills, to help with your test taking strategies, to help manage things like test anxiety, to help you develop your time management so that you can move through all of your courses efficiently. So there's learning specialists that are available by individual appointment. You can go see them at any time for any reason. As President Ross said, we also maintain something that we call our early detection program. So you might be used to your undergrad where you might have just one or two evaluations, like a midterm and a final exam, and you got to hope you're having a good day on both those days. We don't believe in that philosophy. The more times that we can get you to sit for evaluations, the less scared you will be of your evaluations, the more comfortable you're going to be taking your evaluations. So that's the philosophy. The better we can equip you to getting ready for that, the better you'll do. So what do? We have a minimum of 4 large evaluations per course, 3 block exams and a final exam that are relatively evenly weighted. So that means 4 evaluations. So you don't have a good day on one of those days, you know you've got 3 more that can help out. We also have minor evaluations in between those. So our quizzes, our team-based learning, our problem-based learning, all of these are in different courses. So we have a minimum of 3 quizzes per course. Some courses go beyond that, and we also do team-based learning on top of the quizzes. So in general, you get evaluated 7, 8, 9 times in each individual course. So by the time you're done with that course, you know exactly how to handle questions in this area. You know exactly where your strengths and weaknesses are. And this early detection program is because we have these evaluations spread throughout the semester. If we see students who are underperforming, we get that feedback basically by week 2 and every 2 weeks after that. So we identify students who might be at risk, who might need more individualized help, who might need appointments with the learning specialist or with our student counselors, and we can intervene proactively. We don't have to wait to the end of the semester. We don't have to wait for things to become a train wreck. We can intervene as early as 2 weeks to say, hey, things don't look like maybe they quite clicked for you. Maybe we can redirect and try something else. So we do that in every course. Every course director receives training and a mandate for performing that early detection program. On top of that, we maintain 21, 22 active student clubs, everything from faith-based organizations to medical disciplines that you might be interested in going into. We have some that are more sports-based. So the ability to get integrated into the student body and to really get to know your peers and your cohort is absolutely unparalleled. So what I hope that I've conveyed to you with all of this kind of diverse information here is that UMHS is built from the ground up so that your faculty members are experts, your faculty members are accessible to you as much as possible, that your peers are accessible to you, and that the entire system is structured around mentoring you into success. So don't think about it like an academic program. Think about it as the first 2 years of your early mentorship. I don't know if I missed anything on my list there.
Thanks, Greg. I think you covered it all. So, and so that kind of gives you a little perspective on the faculty and how we mentor in our early detection program and to ensure that the students are going to perform well. And I think evidence of the success of that is that and this really sets us apart from many of the other institutions. We only have a 4% attrition rate at UMHS. One of the things that you should be aware is many of these institutions, especially the larger ones, have anywhere between a 30–40% attrition rate, which means that you make it halfway through the program and all of a sudden you're stopped and then you have to figure out what you're going to do next. And my view is that we do everything in our power to ensure that you're going to be a successful candidate, and that includes the mentoring, the tutoring, the utilization of our learning specialists to work on different skill sets, so test taking skills, time management, those reading comprehension, all really important skill sets that you need to have. And they work with you throughout the basic science program. And then, we have counselors. We have a team of counselors to work with our students. Test anxiety is big in medical schools, whether you're in the United States or the Caribbean. And, the getting over that is a really important part because you have to ultimately sit for USMLE. And so by working with our counselors, you're able to overcome those things. But also the fact that we start to do weekly quizzes, really important, because the more quizzes, the more tests that you take, the more you overcome the test anxiety, and that's an important aspect of our academic program. So one of the things that I like to do is we talked a little bit about the facilities, the curriculum, the faculty, and we have various programs. So we have an ARP program, accelerated review program. We'll talk a little bit about that a little later on. We have an extended basic science program, and then we have a traditional 4-semester basic science program. I'd say 85%, maybe 90% of our students are choosing to either they're accepted directly into extended basic science program or they opt into the extended basic science program. And what it does, it allows you to complete the basic science program in 5 semesters versus 4. We prorate the tuition, so you pay the same tuition amount if you were in the 4th semester or 5 semester. But what it does is it reduces the amount of material that you have by 1 course per semester. And what that does is it gives you the ability to really benefit from just focusing on a limited number of courses, perform at the highest level possible. We know that there's a correlation between performance in the basic sciences and how you perform on USMLE Step 1. So the better that you do in the basic sciences, the better you're going to do on USMLE. Um, and I know Holly went through the EBS program. Maybe Holly, you could do a couple things. One, kind of talk about your experience with the EBS, how it prepared you for USMLE, and then maybe talk a little bit about the academic program as well as what was it like to live in St. Kitts, and did you enjoy that experience too? So I'm giving you a lot to talk about.
I got it. So I was accepted into the EBS program. I will say I think the admissions committee does a really good time getting to know a student during their interview process to the school, and they do a really great job at putting a student in a program that they'll likely be the most successful in. So the EBS program is the extended basic science program, which is 5 semesters in St. Kitts. For me, I still think it's a large workload. I think it's definitely a lot harder than my experience in undergrad, but I think that's very normal when you're doing an advanced degree. So I really liked my experience in the EBS program. If I had a choice, that's the one I would pick. I think I had a lot of friends who were in the ARP program who speak very highly of that program as well. And I also have friends that have been in the med program that speak very highly. So it is individualized process when you're going through the interview process. And I do think I trust the school completely to put a student in where they'll fit. Um, so my academic experience when I was in St. Kitts, I did feel very supported as a student. I know that was touched on earlier. I think the teachers do so much to help not patients, sorry, to help us succeed, but it is a lot of individual time that you have to put in. I definitely utilized everything that was available to me. I did the peer mentoring program. I went to TA office hours. I went to my professor's office hours. Because really with the workload, you really don't want to get behind. So the school does everything they can to make office hours accessible to you. So I really did. My favorite thing about the school was the small class sizes and the teachers know your name and the early detection program. If you are falling behind, they're not going to let you. They're going to really push you to find something else to work, different study habits. They'll put in the time with you to help you be successful. And then my experience when I lived on the island, when I went to St. Kitts for orientation week, that was my first time ever on the island. I think um, not having gone to the island and going down there for orientation is very common. You don't need to go down to the island before a lot of, you meet a lot of people on the plane, and it was also a lot of my friends' first time going down to the island. Something really cool on the website is a virtual tour of the school. I know when I applied, there used to be a DVD we used to watch, but I will say I was so impressed with the campus. One of the things my parents wanted to know was, is this a safe place to go to school? Is this a safe place to live? Throughout my whole experience on the island from day one, even going to campus, there's a security guard. You have to show your badge. They know who you are when you're walking on campus. I felt very safe on campus. It is beautiful. And I also felt very safe on the island. For me, the adjustment from coming from Michigan to living in St. Kitts was very easy for me. I felt like I could get everything very easily in the stores there, and I had a great experience. So, groceries, there's a lot of grocery stores on the island when you go down for orientation. The school does a very good job with showing you where the grocery stores are, doing a lot of activities so you meet your future classmates. But the grocery store has everything that you would need. So there was no big adjustment there. Is there any other pictures I can talk about? Let's see. Okay, so these are great pictures. When I went down for orientation, you are very nervous going down to a different country, but President Ross is there and does a great job with setting up dinners, a beach party, orientation for you to get to know your fellow students. And that's a great picture of you, President Ross. I think this is one of the only medical schools where you'll find a president so involved with students. You can just tell from this presentation how much he cares, and he's very passionate. And I think that was one of my decisions when I was picking a Caribbean medical school that I was looking for. So I love this picture.
And Holly, I have to tell you, it's one of my favorite things to do. So every new semester, I get an opportunity to spend time either at a beach party or on a catamaran trip with the new students, and you basically have me at your beck and call for 5 hours, and we get a chance to get to know each other. We chat, we talk. I learn more about you. You learn a little bit more about me. But the one thing that I always share with the students is that I'm here for you. So you have questions, you have concerns, you have problems, you have anything that you need to discuss, you can email me. Half the times I'm up at 2 o'clock in the morning, so I'll be responding to any communication that you send to me. And I have an open door. I believe in an open door policy. So anytime there's a concern or a question, I'm there for you.
And Just two things I'll point out on this one. First, I've never met another university president ever who gives out their own email address, and yet every student at UMHS has President Ross's email and does get those responses. And the second thing I was going to say is that that picture was actually my current class of students at this point. They sat and wrote my exam this morning, so it's just nice to remember what their smiling faces looked like.
If you can, Sean, just kind of go through some pictures of the campus. I would love to share with the students what the campus actually looks like, and then we could do some island shots. So this is basically our skills lab. It's automated. We use high fidelity and low fidelity simulation. We have iStan. We have also a variety of other high fidelity simulators. And we're constantly acquiring them. We utilize this facility to work with professional patients as well as amongst our students. We utilize simulations, and we also do grand rounds at the local hospital for students in ICM. We also utilize this facility for physical diagnosis. So from day one, you have clinical exposure, and we've introduced in all our basic science courses clinical material, clinical vignettes, because USMLE style one, USMLE is more clinical oriented, although it's basic sciences, it's still mostly clinical vignettes. So we've included that type of approach into our basic science program. And this, the top left picture is our state-of-the-art auditorium. The bottom left is one of two multi-purpose labs. The top right picture is one of the small classrooms. We typically utilize that one for our accelerated review program, which Sean is probably going to talk a little bit more about. But just a quick introduction to that. There are students that we believe are qualified to get into medical school, but they need to strengthen their foundation. And the whole goal of the accelerated review program is to give you a taste of virtually every aspect of the basic science program, every course, every faculty member you are exposed to in the basic science program that teaches in ARP. And that at the end you sit for a comprehensive examination, and if you pass, you're automatically accepted into the basic science program. And from what I understand from all the students who've gone from ARP, they are extremely happy with the caliber and the quality of the education, and it really has prepared them for medical school. And as you can see from our 4% attrition rate, we've done a really good job in preparing these students for medical school. So it's a really strong foundation. So if you go back to the prior picture, yeah, so the top right is our ARP program, and then the bottom right is our research lab, and we're very dedicated to providing students with research opportunities. We believe that in this day and age, when you're applying for residencies, it's good to be exposed to research and be able to show that on your CV, because residency directors get thousands and thousands of applications from people that are unknown to them. But to add to your resume, your CV, that you have research, it just gives you a little bit more of a leg up, and we really support that, provide students with research opportunities, and many of our students are published, as well as our faculty, which is also really adds to your credentials. Craig, we're going to talk about research, because Craig is the person in charge of research in St. Kitts. But before we do that, what other pictures do you have of campus? Is that pretty much it? And this is my anatomy lab. This is probably one of the most state-of-the-art anatomy labs. You see high resolution monitors at every workstation. We use surgical lamps so that you could guide a light directly into the cadaver. We have faculty as well as TAs that rotate throughout the facilities, working with the students to ensure that they understand what they're dissecting. And one of the more important parts, and you have to compare and contrast to other schools, the larger schools down the Caribbean have moved away from traditional anatomy. They're using plastinization or computerized dissection. It's not the same. You're not getting your hands involved, especially for those people who are interested in surgery. To have the opportunity to do a dissection really gives you a different perspective from working with textbooks or with IT equipment or computerization or plastinization. So this is a traditional lab with a 6-to-1 cadaver ratio, and we have two 50-ton air conditioning units that pump in fresh air 24/7. So there's very little smell of formaldehyde in that facility. It's really very state of the art. Any other pictures? And this is our library. It's a beautiful library. It's wireless, although you can plug your computer in. It's open from early in the morning till 11 o'clock at night. They have sections that are set up for private study with carrels, or you can be in the more populated area, which is this image right here. You also have attached to it our Learning Resource Center. There's about 50 computers that students can, or 60 computers that students can access. And our wireless system, students can access our learning management system anywhere on campus, whether you're out under the tent eating lunch, whether you're in any classrooms, laboratories, library, wherever you're on campus, you have full access to our wireless network. Any other pictures? That we saw that earlier. That's our lab. You can stick on this one for a second. Craig, talk a little bit about research down at St. Kitts.
Yeah, I'd be happy to. So research at UMHS might be a little bit different than you're familiar with from undergrad or graduate school experiences. So, I have a PhD, it's in immunology. What did that require? I did 2 years for my master's. I did 4 years for my PhD. And that was me spending basically all of my time in labs. So that's about 2,000 hours a year in labs times 6 years. So we know that medical students don't have the ability to dedicate that kind of time to research. And that's not your area of practice anyway. You want to be a clinician. And most clinicians don't spend their time in biomedical labs. Most clinicians spend their time in clinics and with patients. So research has to take on a different focus when you move into medicine, and we're very aware of that. So research at UMHS is designed around providing you the experience that you need for the career that you've chosen to be a good clinician. And so we focus on integrating our research practices into the basic sciences curriculum as much as possible, with the idea of creating a well-rounded modern viewpoint on medical practice. And so what we try to focus on while you're on the island is opportunities for things like literature review, meta-analysis, clinical case studies, case reports. And the reason is simply this. First, the average medical student has approximately 500 hours in their basic sciences that they dedicate on average to research total. And that usually comes in just a couple of weeks over summers. So your time span is limited. But then the other thing that we have to think about is, what is it that you're going to do? What is it that your practice is going to look like? Well, you're going to be dealing with patients and other clinicians as your primary populations. So we want to make sure that you can make an impact with those people. So literature review or meta-analysis are great ways of getting involved in making that kind of impact. So what's a literature review? If you're not familiar, a literature review is a narrative story. Okay, it takes the current state of research and knowledge in a very specialized area, and it creates almost like an easy digestible summary about the current status of some topic. So it might be a new drug that's come on market. It might be new findings in a disease that we might be familiar with. So as a good example, as a great example, right now there's a lot of talk about associations in the immune system of the GI tract and the development of neurological diseases like Parkinson's or Alzheimer's disease. That's probably not an area that most clinicians are familiar with. They know about Alzheimer's, they know about Parkinson's, but providing links between GI immunology and neurological diseases is not something that many people, unless you're a specialist in that area, know about. So what can we do? Individuals who are specialists can write literature reviews to say, hey, this is the cool new thing that's going on in this area. Here's 10 of the latest publications in this area. Here's a quick summary. And now you've brought people up to date in that area. So really impactful and a really great area for medical students to get in. Meta-analysis is about taking some data from different groups and reanalyzing it in a new way that can help people to identify findings that weren't immediately obvious in the original publications. And then clinical case reports, all the way from anatomy class in your first semester to the Introduction to Clinical Medicine course in your last semester. You have contact with cadavers, with patients. And so you get individual experiences in those areas where you can identify unusual physiological changes, where we can identify unique structures or unique findings in a patient. So as a really good example right now, I'm working on a clinical case report from a student who's in the main semester right now. So she's in the bridge into her clinical program. But when she was here on the island and doing Introduction to Clinical Medicine, she saw a patient who has an absolutely unique abnormality in their heart structure. There's only been 4 or 5 documented cases of it that we can find worldwide. So she's writing a case report about that right now. And so these are areas where you can publish or start working on research in your basic sciences. As you get into your clinical sciences, more and more opportunities open up for you. Every hospital has a clinical research director. Every hospital has attendings and residents who are involved in research, either in biomedical labs or things like clinical trials. So one of the other things that I have done before coming to UMHS is I was a clinical trials manager in immunology. So I saw 20 or 30 new immunology drugs that are coming onto market in the next 3 to 5 years. Hospitals are constantly enrolling patients on those clinical trials. And so it's a great opportunity for you to publish new information in these areas. So research at UMHS is really focused on integrating our basic sciences and our clinical sciences curriculum into your medical practice to make you a peer with other clinicians. And I'm very proud to say that we have some great success. Since 2020, we're a small school, we're a boutique medical school. We still have over 40 publications that have gone out in that time. And that includes being shut down and becoming virtual during COVID. So we're very, very proud of that record and what our students are accomplishing.
Thanks, Craig. Sean, can you show a few pictures of the island? So one of the things that is incredible. So I've been going down to the Caribbean since 1978, and I used to be going to, used to go to Dominica, where the medical school was, but then we established a veterinary school in St. Kitts in 1983. So St. Kitts is basically my home away from home. And it's probably one of the most beautiful islands. I've visited many of the Caribbean islands. It's super friendly. The people are really warm, friendly, nice. There's lots of different, accommodations, restaurants, hotels. This is just a view at the end of the island. This is my favorite restaurant in the Caribbean. If you ever go there, tell them I sent you. The owner knows me. You'll get the best meal that you've ever had in your entire life. His name is Marshall. He's from Jamaica, but he makes just incredible food, and you can see the view is spectacular. So if you're looking for a special dinner, special event when your family are down or you have some friends, this is a great place to go. What other pictures do we have, Sean? And this is if you're in Frigate Bay, where a lot of our students live, which is kind of more of the touristy area, the hotels, the restaurants. It's about a 10-minute drive from the campus. We have buses that pick you up and will drop you off at your locations on campus, so you don't even need a car. But if you decide to go for a little bit of a drive right in Frigate Bay, you can go to the end of the island. This is a national park. I've actually jogged this all the way to the very end. It's about a 5-6 mile hike to the end. There's some restaurants down there. There's a hotel down there. There's monkeys all over the place. There's the on the left you have the ocean view, and on the right you have the Caribbean view. There's some really great snorkeling on the Caribbean side. Don't try snorkeling on the left-hand side because there's bad uh, what do they call it? Undertow there. But it's a beautiful drive. This is where we have our parties at the end of this road that you see there. There's a beautiful beach called Reggae Beach, and there's a nice restaurant there, and we have a lot of our students go out there and have a great time. What other pictures you have? And this is another just
Don't worry. When you want to get in the water, I'm a dive master. It's one of the things that I did while I was living in St. Kitts. Really happy that it gave me the opportunity. So when you're ready to get in the water, you let me know and we'll get you certified for scuba diving.
Absolutely. And as you can see, this is really paradise. Now, the bottom line is that you're studying, 24/7, but the reality is you do need to take breaks, you do need to go out, you do need to enjoy, and there are lots of things that you can do on the weekend to kind of get away. And the zip lining is pretty incredible. I've done that a couple times. They take you way up on a mountain and you go over various gorges, and it's all tropical rainforest and it's beautiful. We built a soccer field on campus. We have basketball, we have gym. So there's a bunch of different resources. We have a lot of activities for students to get involved in. We play, collegial sports against, all the other universities that are down there in soccer and volleyball. So we tell students that, you need to de-stress. There's a lot of stress in medical schools. So take advantage of the gym, take advantage of some of the activities that are on the island, and keep yourself, healthy, fit, and you really will benefit from that. So you spend, 4 to 5 semesters down in St. Kitts, and then you transition to the United States for your last semester before you enter into the clinical program. And there you'll have Introduction to Clinical Medicine 2, as well as our review program, our integrated review program. We talked a little bit before about that unique integrated review program, utilizing Kaplan, NBME, self-assessments, the CBSE, the Comprehensive Basic Science Examination created by National Board of Medical Examiners, as well as integrating UWorld throughout the review program. So it's very strong. The ICM really helps you seamlessly transition into the clinical program. You're doing some rounds at various local clinics and hospitals. We have our own skills labs up there, small group interaction, lectures that prepare you for your clinical exposure. And the key is that we want to make sure that when you start your clinical program, that you are on par with any student from a U.S. school. Holly, maybe you can mention or talk about your experience in Maine and how that prepared you for your clinical program.
Sure. I think my favorite part about my experience in Maine was the preceptor experience. I will say in my 5th semester down on the island, we actually do go to the hospital. So I feel like your first experience as a medical student in the hospital setting is on the island. But this preceptor experience in Maine is the first time you're back in the United States. The school will partner you with hopefully a physician that is in a field that you're interested in. So if you're interested in family medicine or OB or psych, they can try to connect you with a preceptor, so you can get some of that personalized experience. My majority of my time was studying, obviously, for step 1. I thought the Kaplan review course was amazing because they're the actual It's not just watching videos and you're studying on your own. They actually have the Kaplan professors that come to the classroom. They're available on break time to answer questions. And I really did think the skills lab was really beneficial because after you pass step one and you start your rotations, you do feel like you have a step up from other people because you've practiced doing ABGs, intubation. They have what they bring in also, which was another one of my favorite parts, is professionals that act as patients. So you get to have the teacher watch you and give you really positive feedback on how you can be better with your interaction with patients. So this semester in Maine was great. I obviously missed living on the island, but again, this was a really easy adjustment for me to be in Maine. I ended up staying in Maine for a couple extra months to study for step one on my own. And a couple of my friends did that as well. So
And Holly, when you entered in the clinical program, how do you feel that how did you feel compared to your U.S. counterparts? Do
sure.
you feel that this program prepared you well?
Sure. So I started my third year rotations at McLaren Pontiac in Michigan because I'm from Michigan and I wanted to be local. And we rotated with Michigan State medical students. And I definitely felt like we were very well prepared, equally, if not better prepared than the other students. So it was a great experience.
One of the things that I've heard from my students before is that there's a difference between a U.S. student and a Caribbean student in that the Caribbean students are like sponges. They want to learn as much as possible, and they're just so dedicated, and they love what they're doing, and it's it's not always an easy commitment to pick up, move out of the country, go to someplace new. You've never been away from home. And so my view of people who go to Caribbean medical schools is that they are a very strong, dedicated people that can just achieve whatever they put their minds to, and that there's no the term failure is not in their vocabulary, and can achieve anything they want. They're very resourceful, and I think a unique breed. And it's one of the things that I'm so proud of in terms of my graduates, of how much they have achieved. And they've not only accomplished their goals of becoming physicians, but they really are just very outstanding, strong individuals that are leaders in medicine today. Um, I don't want to get too soapy about this, but anyway, I'm very proud of my graduates. So after you complete the fifth semester in Maine, you progress into the clinical. You take your USMLE, you pass USMLE, and then you enter into the clinical program. We're affiliated with over 26 teaching hospitals throughout the United States. We have programs in New York, Connecticut, Maryland, Michigan, Oklahoma, Florida, Georgia, California, Canada, and Puerto Rico. Oh, there's a list. I should actually look at the list. Anyway, and Wisconsin. And we're always looking to develop additional clinical programs, especially in like areas like California, Canada. We want to add more clinical programs. We're also looking to potentially add some programs in the UK. We were the only school that's affiliated with any Caribbean medical school, only Caribbean medical school that's affiliated with a U.S. medical school. We're affiliated with Ponce School of Medicine. So students from Puerto Rico should recognize that that there's lots of clinical opportunities through Ponce with many of their affiliated hospitals. And we're adding more hospitals as we speak. So there's just lots of clinical opportunities. And for students, if there's anyone from Puerto Rico, one of the things that's kind of unique about Puerto Rico is that we found over the last couple of years that many of my graduates don't even have to go through the residency matching program, which is what typically you do if you're in the United States. You go through the match, you apply for residency programs, you're interviewed, and then if you matched it at a hospital, you get a residency. But in Puerto Rico, not only do you go for the match, but for many of our students, they're actually being offered positions before the match because they recognize the caliber and the quality of the students, the reputation of the institution, the affiliation with Ponce School of Medicine. All that adds up to, a very credible quality institution, and the students are very well received. So, significant percentage of my students from Puerto Rico choose to stay in Puerto Rico, but we were also seeing that students from Puerto Rico, have the best of all worlds because they can also go to the United States where they're very well received. And bilingual doctors are very much in demand in the United States. And for my Canadian students, you can choose either to obtain a residency in Canada or United States. In the last round in 2025, this year, yeah, 2025. We actually had a number of people who obtained Canadian residencies as well as Canadians obtaining residency in the United States. The difference for Canadians is that there's a lot more opportunities in the United States for Canadian residency for residencies than there are in Canada. But Canada is now opening up its door more for international students because they recognize there's a bit of a shortage, and they're now making the process a lot easier for Canadians. And I think, Craig, you're Canadian. Are you starting to see that also?
Yeah, so what's happening now, if you look at the latest numbers for Canadians who are trying to match as international graduates, historically speaking, we're looking at about 30% of individuals who get a match in Canada. In the last two rounds, we're looking at about 70% who got matches. So Canada is becoming much more accessible, and they're making some proactive changes to their matching system to try to make it a little bit more flexible for students who might be interested in matching either in Canada or the United States. The other thing that I would tell you is, as a UMHS graduate, if you are Canadian, you really do get the best of both worlds. If you complete your residency in the United States, if you elect to do that, and that's not a bad idea at all, as long as your residency is of equal length to the residency that you would have done in Canada. So, as a really good example, family medicine is the same residency in either. Then your license that you get at the end of that can come back to Canada without really any other work that you need to do for that. So, there's a lot of good options for Canadians that are developing and accessible through UMHS.
Great. And I think some of our visiting faculty are coming in from Canada too. And there might be some other possibilities because I'm having conversations with the provost at University of Ottawa. And I've also been talking to Guelph University recently about other potential programs, maybe joint programs that we could develop in the future. So I'm a big fan of Canada these days. Anyway, students enter into the clinical program. The first year into the clinical program, that you're taking your core rotations. As you can see right here, surgery, internal medicine, family medicine, pediatrics, OBGYN, psych. Uh, and that has to be done at our affiliated hospitals. Those are the hospitals, teaching hospitals, same hospitals that U.S. medical students go to. They have ACGME residency programs there, and they're reviewed constantly by our accreditor, ACCM. So they do periodic site visits to all our hospitals to ensure that we're meeting their standards, LCME standards of accreditation, and that it's a quality academic program. And then for your senior year, students can choose to go to either our affiliated hospitals, or they have the option to go to any teaching program in the United States as long as they get approval from our clinical dean. And that's where this is what another area that's really important for all of you. When you're applying for a residency, it's really good to go to those hospitals and meet the people who are in charge of hiring. And so when you're in your senior year and you're thinking about residencies, you want to start to pick the hospitals that you're most interested in and try to obtain a clinical rotation in that hospital. Try to meet with the residency directors, DMEs, any other person that could be influential, and press upon them how good a student you really are and how good a resident you would be for them. And think about this. This is really important that these residency directors get thousands of applications from unknown individuals. But if you've done a rotation there, an elective rotation, and you've met these people, it really gives you a leg up over everybody else. So I urge our students to always go to those hospitals, especially in your senior year, where you can showcase yourself and prove how good you are. And I really think that helps a lot because in last year, we had close to 93% of our graduates obtain residencies. And I think, in fact, since the inception of the university, we have a 93% placement of our graduates for residency programs in the United States, which is, in my view, a testimony to the quality of our students and the quality of the education and the reputation of the university. Holly, what was it like when you applied for your residencies and fellowships?
Sure. I applied to a lot of school or a lot of hospitals just because obviously that's a scary process. And I think what they say is if you have 7 or 8 interviews, you can kind of take that stress off you. You'll likely match in one of those programs. I matched in Chicago at a small community hospital, West Suburban Medical Center, which is right in the town that my brother lived where I wanted to live. And I didn't do any rotations there. So yes, I totally agree with President Ross. I think if you're really, really passionate about matching at one specific hospital, if you can get in there and meet people early, that definitely gives you a leg up, but it's not like always necessary. I really felt the school was helpful because in the New York office, they have someone that can read your personal statement, help with interviews. What I think is really cool about our school is we have a Facebook group for current students or alumni, and they'll help with, you can message on there and someone can look over your CV or you can do practice interviews with each other. So just the support network that you have with the school and also your fellow colleagues makes the whole interview process and applying for residency a little less stressful. And then, so my residency in internal medicine was 3 years. And then when I applied for fellowship, I had to again get all my transcripts from UMHS and I had to redo, my application process, another personal statement. So obviously I'd been removed from UMHS for a while, but the process of calling the New York office, getting my transcript, it was sent that day. Someone read over my personal statement. So for me to be out and have graduated from UMHS for 3 years, but still be able to call and have everything that I need within less than 24 hours is amazing. So you really just don't feel like a number or a burden. They really do everything they can to give you what you need and on time. So I thought the process was really smooth just because of how helpful the school was and the resources that we have. But no matter if you go to a Caribbean school or a US school, there's obviously stress because it is a match program. But yeah, I ended up matching in one of my top programs, and Vanderbilt for fellowship was my top program as well.
Thank you, Holly. So I think that Sean, we pretty much covered every aspect. We've talked a little bit about our accreditation. We're accredited by ACCM. We're accredited also by the government of St. Kitts. Our students qualify for ACFMG certification. That's important to understand. If you guys are shopping around, you're looking at other Caribbean schools, the ECFMG has created a new requirement that the school must be accredited by a body that they recognize in order to be certified for not only licensing examinations but also to do a residency in the United States. Our accreditation through ACCM, as well as our accreditation through St. Kitts, is recognized by ECFMG. So our graduates qualify for ECFMG certification and qualify for residency and licensure throughout the United States. If you take a look at my website, you can see all the different locations, the states that we're currently in, and I think that our students are now currently licensed in virtually every state in the United States, and so we're doing well. We have a strong alumni organization. Holly's part of that alumni organization. And we really support our graduates. We believe in them. We're dedicated to them. We're dedicated to our students. And we believe that you deserve the best quality education possible. So Sean, I'm going to turn it over to you and let you follow up on your section.
All right. Thank you, President Ross, and thanks to everyone, and thanks to our audience for engaging with us in the Q&A area. We appreciate it. Certainly going to remain open as you have questions. There were just a couple of questions about tuition and fees. We'll get to that in just a second. And that's certainly one of the questions that you would have at this point after you've heard so much information about the university from the faculty perspective, from the administrative perspective, and from the student perspective. How do we get you from where you're sitting right now, learning about medical school, how to get into medical school, and then how do we get you through and where you want to be ultimately, which is practicing medicine with the letters MD after your name? Well, it all starts with an application for admission. And we make it easy for you. The admissions process at UMHS is pretty seamless and pretty quick. And I think it's interesting when you think about the process in the US and Canada. It's basically, if you think about it, it's really an 8 or 9 month process. You begin applying late in the spring, a little over a year before you intend to go to medical school. And then you go through the summer and you have supplemental applications. And then you find out in the fall if you'll be, if you're lucky, you'll find out in the fall if you'll be interviewing. And then interviews happen through the fall and the winter and the early part of the spring. And then finally, in the spring, you find out if you were accepted, or maybe you're placed on a wait list and the wait will become even longer. So it's a months and months long process. And at UMHS, it's a rolling process. So the sooner you apply, the sooner we can work with you to get your application together. And the sooner you will find out if you were interviewed. And then the sooner you will interview. And then the sooner you'll get a decision because the admissions committee meets on a weekly basis. So to go through all that, the application is available online at umhs.org, right on our website. You can fill out our application for admission, section by section, or we also give you the opportunity, if you've already completed one of the major application services PDFs, or one of the major application services applications, to send us a PDF copy of that application, and that can serve as your UMHS application. And the reason we do that is because we're asking really all of the same questions. We're looking for all of the same basic information about you and your academic background and history. And so you can submit a PDF and make the process very, very easy for you. And again, that happens right online on our website at umhs.org. In order to be considered for admission, you need to have completed at least a minimum of 3 years of undergrad education. And most schools, that typically means around 90 credits. But if you're in a 1 credit program, basically you can think of it as, have I completed the equivalent of 3 years of undergraduate education? We do that so you can apply, as you're beginning your senior year, as most medical schools, will do. Most students come to UMHS with at least a bachelor's degree, and some have advanced degrees as well. Many have advanced degrees, as a matter of fact. So it's not like you're looking to cut corners here. We do this, like I said, so you can apply during your senior year. We have the standard slate of pre-med prerequisite coursework that's required. And that's basically, if you're in a pre-med track at your undergraduate institution, you'll be meeting these requirements. It's basically 1 year of introductory or basic biology, bio 1 and 2 with lab, 1 year of introductory chemistry, again, intro to chem 1 and 2 with lab, 1 year of organic chemistry. And so it's typically going to be organic 1 and 2 with the lab that's associated with it. Some schools don't have an organic 2, but you have a biochemistry that you can take. We can sub that in. You need a physics course as well, all with lab. So all of those hard sciences will be with lab. You need English coursework as well as math, and that's typically going to be calculus or stats. The MCAT is required, and you see an asterisk on the screen there. And that's simply because it's required for citizens and residents of the United States, or anybody who's completed their undergraduate education in the United States. The MCAT is not explicitly required for Canadians or students from who have gone to who are from anywhere else in the world. However, it's always recommended. Again, it's not explicitly required though for Canadian students or those from elsewhere in the world. We're going to be looking for a CV or resume from you as part of the application package, and that's important because we want to see what work you've done to learn about the practice of medicine. What have you done? You want to be a physician? That's wonderful. What have you done to learn about it? Have you been able to shadow? Have you, scribed? Have you worked as a medical assistant? Have you been an EMT? What have you done to investigate this? And because it's really going to be important that you've tried this out. And, we don't want the first time you saw blood to be in the anatomy lab, so, it's important for you to have some sort of experience before applying to medical school. And then to augment your application as well, we do require at least 2 letters of recommendation, or if you've gone to an undergraduate school that has a committee letter as part of their process, we will accept the committee letter by itself. And we do that because multiple people are contributing to that letter, obviously, to tell us a little bit about you. And the recommendations are very important, so we can learn a little bit about you, aside from what we're learning from your transcripts, which we will get, of course, as part of the process. An essay is required, and make sure you follow directions on that essay. We don't want an 8-page manifesto that's 10-point font, single space. That's not really the point here. It's an exercise, and we want to learn a little bit more about you. We want you to tell us something about you, again, that we can't get from your transcripts or otherwise from your letters of recommendation. Once the application is complete, during the process, you'll work with our staff in the admissions office at UMHS. We'll get your application ready. Once it's complete, we will do an initial review and determine if you are eligible for an interview. Unlike many schools who are, because they have 10 times as many applicants as they do seats in their program, and they're really only looking at a very small number of things in their review. We're actually really looking at everything in your background to determine if you're a fit for our program, and we want to get to know you a little bit so we can help you determine if we're a fit for you as well. And so there's a holistic review that happens by faculty, and part of what's really important about that, and the best way to get to know somebody, is to sit down with them and speak to them, get to know them, and interview them. So we interview really 8 out of 10 applicants, whereas you'll find at most US and Canadian medical schools, it's you're talking about 5, 6, 7, 8% of all the applicants actually get an interview. And those interviews are happening. They can be face to face, but many more of them certainly are remote these days. It's just the way of the world. We have admission staff who are located around North America, and you will be assigned, one of them based on your geographic location. And then you will set up a time to meet with them virtually and discuss your background and qualifications for medical school. Once the interview happens for you, then your file will go forward to the members of the admissions committee. And the admissions committee, it should be noted that the admissions committee is made up entirely of faculty. They get together, they review your background, and then they vote, and then they make the decision on your application. There are a number of different decisions that can come back from the admissions committee. There's obviously yes or no, acceptance or denial. Those two are there, just like there would be at any level, any type of program. I'll start at the bottom though. If you're denied admission, we like to look at it as more of a not yet. Instead of a no, look at it as more of a not yet. The admissions committee gives us an admissions information about their discussion about you, things you can do to improve your candidacy, and then perhaps there will be a time 6 months down the road, 8 months down the road, when you act on their recommendations. After you act on their recommendations, a new application could bring a different result. And then you heard a little bit about the accelerated review program from President Ross a little bit earlier this evening. And essentially, this is really reserved for students who maybe aren't quite ready to succeed in semester 1 of the full MD program. So with the accelerated review program, as you can see here, it's designed to help students build the necessary foundation to succeed in medical school. And that word foundation is really important. Depending on your path to this point, maybe you've been a science student your whole life, but you've struggled in certain areas of the sciences and you just need some strengthening of that academic foundation. ARP might be a good fit for you, depending on what you've done. We've got students who are career changers who maybe don't have a strong foundation in the sciences at all. They've taken the prerequisite courses, they've done what they've needed to do, but perhaps they need a little bit, again, strengthening of that foundation, and maybe ARP is the right pathway for them. Again, this is the decision of the admissions committee, the faculty who have been teaching medical school, not just at UMHS, but across the United States and Canada as well. This is, very highly experienced faculty that we have. People on the admissions committee have been reviewing files for many, many years, again, for multiple programs. And they can look at a file, they can look at a background, they can read an interview summary from one of our admissions staff members, and they can make a determination on what the best pathway will be for that individual student to guarantee them success. You saw our attrition rate is 4%. And part of that, some students don't go straight into the MD program. They do the 1 semester, 15-week accelerated review program that gets them ready. It gives them a smattering of information from all of the basic sciences. And there's a focus there, though, on study skills, test-taking techniques, preparation, what it's going to take to be successful academically how you're going to get there, how you're going to study. So ARP is an option that the admissions committee has at their disposal. If they don't feel that the student is ready to succeed in semester one, you may be invited to come to the accelerated review program. The great thing about ARP, well, there's many great things about ARP, but one of them is that all you have to do is pass the program. This 15-week program, you pass the program, and there is a seat reserved for you in first semester, the next semester. So you automatically promote into first semester. I see Dr. Ayer coming on to add some thoughts as well.
Yeah, I just wanted to say, Sean, I really like the highlight that you're giving on how the admissions process works. So I just wanted to jump in for 1 second to say I'm one of the individuals who are on the admissions committee. So I've been, reviewing files for the years, all the time that I've been at UMHS. And I think one of the things to remember when you're applying to a medical school program is a lot of admissions is done by committee who don't interact with you after that point. Those individuals work in an administrative office and they don't have day-to-day contact with the students. It's very different at UMHS. When faculty members are reviewing your files, we're picturing you as one of the students who's going to be in our class in a semester or two. So we get to know you a little bit before you even really get to know us. And as Sean is saying, we have these options that we can recommend between ARP, the med program, the EBS program. And what we're doing is we take it very seriously as our duty of care to anybody who's coming into the university that you end up in the program that's going to give you the best shot at success, because we're going to see you. We're going to spend every day with you. We're going to see your face. We're going to see your highs and lows. And so we take that admissions decision incredibly seriously. And that's probably one of the single most important things that we do as the faculty members on that committee, is to really think about what's going to be best for you in every regard.
That's a really great point, Dr. And thank you for jumping in. The faculty really have a vested interest in taking as much time, as possible and learning about each candidate. And what I'm going to say in a second sounds sort of counterintuitive to that point, because the process can be very quick, but I'll come back to that in just a moment. And just to put a fine point on this, obviously, again, we talked about yes or no, acceptance or denial, with sort of the accelerated review program being another option that our admissions committee has at their disposal. The acceptance is broken up. There's two different options for acceptance, and that's either placement in the standard basic science program, which you heard described earlier, which is 4 semesters, or there's placement in the extended basic science program, which is 5 semesters. And remember, whether you're in the standard 4-semester program or the extended program over 5 semesters, the coursework is the same. It's just either packed into 4 semesters or spread across 5 semesters, and the tuition is prorated as well. So there's really it's really about what's, like Dr. Ayer said, finding the right pathway for you. What's interesting is that I really believe that most medical schools, the faculty at most medical schools, feel similarly to how Dr. Ayer described, his feeling about reviewing files. It's just that the process at most medical schools means that, those faculty members get together at one particular point during the year, in the early part of the year, and they make decisions, and then decisions are transmitted at one particular time of the year, because there's only one intake, per year. And at UMHS, as you heard, there's 3 intakes per year. The next one is this May. In 2.5 weeks, we will be welcoming our next class, and we are still accepting applications for May, because May is less known as an option to start medical school. So if you've already completed your undergraduate degree and you're ready to go, May is a great option for people. Then there's September. September is the traditional start date in U.S. and Canadian medical schools, so most people are thinking about September. We also offer an opportunity to start in January as well. So we have 3 entry terms per year. So because we're bringing in students different points of the year, we have a rolling process. So while in the U.S. and Canada, the process runs its course, the interviews happen during the fall and the winter, and then the committee gets together during one particular point of the year and makes all of their decisions in one shot. The process that you heard Dr. Ayer describe happens weekly. And the committee is constantly reading files throughout the year. The committee meets every single week. The committee makes decisions every single week. We transmit decisions every single week. So everything happens on a rolling basis. So while everything is very involved, everything can happen pretty quickly. Depending how quickly you get your application together and all of your supporting credentials together, your interview could happen less than a week after your application was submitted, which sounds crazy, but if you have everything together, we can look at everything and make a decision on whether you're going to get an opportunity to interview. And then depending on when during the week you interview, you could be that week during the review, or you could be the following week. So the entire process can take a matter of a couple of weeks. And so that's why I say things can happen very quickly, and everything happens on a rolling basis. So what do we have next, John? So after decisions, basically we want to talk about tuition, and we had a couple of questions about tuition. Tuition at UMHS really, I mean, this clearly stands out. I mean, the only bar that's lower on the graph that you see here are in-state public institutions in the United States, but those are fewer and further between, or at least the opportunities to attend there are fewer and further between, as many in our audience would already know, given what the state of admissions to med school in the US looks like. You've got well over 50,000 people that are applying to med schools in the US each year, and you've got about 23,000 seats in US med schools. And those public institutions that are costing across 4 years a little bit less than we do, again, very, very few of those opportunities exist. Many, many more opportunities are happening out of state for students at public or private institutions, and you can see the costs there and the cost differential on average at those institutions versus UMHS. And then, of course, you have other options outside of North America, particularly in the Caribbean. And those tend to be, ironically enough, your most expensive options at well over $300,000 in tuition for 4 years. So why is UMHS only around $185,000 for 4 years of education? Well, part of it was something that President Ross mentioned earlier when he was describing the background of why UMHS was created. Looking around at the other medical schools, looking at their ownership, it's not owned by one person or one family. They're owned by educational conglomerates. And when you have large corporations involved, their main duty is to shareholders. And that's where the Ross family comes in. And we are really sort of unique in our space because President Ross, his allegiance is to his students and putting money back into the university and creating the best educational experience for you. And so that's where our tuition being, considerably lower than other institutions becomes very interesting because of the value that it represents. But before we talk about the value, we want to talk about how we help you pay for your education. There are scholarships and loans available. Scholarships are based on undergraduate GPA, your MCAT, all of your academic, background, and you're automatically considered for them with your application. And you can see on the screen, you can also go to our website and you can take a look at the breakdown of scholarship opportunities at any point, beyond, this evening. So you can see there are a number of different scholarships that you'll be automatically reviewed for based on academic background. And there are a number of different specific scholarships based on your individual experience. If you're, basically, if you've gone through the accelerated review program, if you're a student who has citizenship in St. Kitts, if you're a veteran of the U.S. military. So there are a number of different scholarships. So again, more information available on our website for you to read through about those options. Financial aid is also available as well. We partner with Sallie Mae, which is really just about the largest private lender for educational loans in the U.S. So, it's one of the first, after you're accepted, one of the first contacts that you will have is with our financial aid office, who will work with you to let you understand what your options and opportunities are going to be for financial aid. And so that process will happen fairly quickly and with the staff in our financial aid office as well. For our friends in Canada, a little bit separate opportunities for you, lines of credit from the 5 major Canadian banks. So there are different opportunities there as well. So all of what you're hearing, you've heard a lot, again, from faculty and administration and student and Dr. Workus from the student point of view. And yet, for all of what we've talked about, we have really the lowest, one of the lowest tuition numbers, that's out there. So it really represents a tremendous value. With our 92% residency placement rate, our 96% student retention, Thanks to dedicated faculty, learning specialists, everything happening on a state-of-the-art campus, which gets you ready to come into the United States and move through our network of affiliate teaching hospitals, that in turn gets you ready to move on and practice, medicine in your chosen area of specialty, with, again, great opportunities for residency. It's really amazing, the value proposition, that we're offering at UMHS. I do want to kind of just end on, showing you how your experience at UMHS will end. And, it comes up in June every single year. After you go through, what you're looking forward to do, and the best way to celebrate it is in a big way. And so as a UMHS graduate, you will come to New York City and you graduate Avery Fisher Hall as part of Lincoln Center. It's a wonderful opportunity for you and your family to celebrate this momentous achievement in your life. And it's just every year, it's really the best day of the year for us. And this is a photo from graduation last year. So it's just a wonderful experience, a wonderful way to recognize you and all of the hard work and effort that you've put in, everything that you have been working toward for all these years, not just the 4 years of medical school, certainly, but all of your years of undergrad, all of your work and effort before that, everything that you've done to bring yourself to this point in your life. So with that, that is a little bit on the university. We're getting, we're running a little, we're running well, and we're doing well in terms of time. So, but I do certainly want to thank everyone in our audience for being here. Any last questions that you may have, please put them into the chat. And with that, I want to thank our panelists. First, Dr. Holly Workus. Dr. Workus, thanks so much for being here, for all of your efforts, for answering questions, and for all of your thoughts this evening. It's great to see you. Any last parting words? Is there anything you can impart to our audience? I mean, you've been through medical school, you've come out the other end, you're going on nearly a decade now of practice in your chosen area of specialty. You've been extremely successful. And again, you weren't able to, you chose not to go to school at home in Michigan. You came straight to UMHS. And so what wise words do you have to impart to our audience?
Sure. Thank you, Sean. I would just say it's a very long journey. So if you're considering it, my best advice to you would be apply sooner than later. I actually took a year off of college, like after college, and I worked before applying to UMHS. And looking back, I wish I didn't do that, and I wish I started sooner. So that would be my best advice to you all.
The sooner you start, the sooner you finish. So thanks so much, Dr. Work. It's great to see you. And with that, I'll also ask Dr. Ayer to impart any last, wise words to our audience. And we do need to update this headshot, I think. So thanks for being with us.
Just a little bit. Yeah. I'm using a better one for my Zoom, my poster now. But what I strongly encourage you, we know that you're looking at all your options. We know that it's very important to you to make the best choice that's going to give you the best value, that's going to get you where you want to go. And so my recommendation, I'm a guy who's done a lot of things in my life, a lot of different things, but the most important thing that I found anywhere that I've been is that the people make the difference. And it's the people that you connect with. It's the people who support you. It's the people who rally around you. They're the thing that makes the difference between the place where you fit, the place where you belong, and just a place where you are. And it's my belief that UMHS is built around the idea that you can become the person that you feel you were meant to through the support of your peers, your friends, your professors, your administration, that everybody has the same goal. Everybody wants to see you succeed the same way, and everybody is invested to that outcome. So I guess my advice is, when you talk to people, when you weigh your options, and when you think about how you want to do this, ask yourself, are these people as invested as I am in my success? Do these people have my best interest at heart, or do these people have some other motive? And I think you will find that the philosophy of UMHS is to enable you to become that version of yourself that you've always pictured. So find the place where the people will invest in you as much as you're going to invest in yourself. And I am a firm believer that that is us.
Thanks so much, Dr. Ayer. I agree wholeheartedly. Great to see you. And with that, I will remind you that this is, of course, the President's webinar, and you heard a great deal from our President, Warren Ross. And so, President Ross, you get the last word for our audience.
Okay, this is my official response. I've taken off my jacket. And it's been a great night. I'm really proud of my institution and what we've accomplished. And for those who are looking for this type of education meaning small, dedicated faculty, personalized education, resources necessary to ensure your success, utilization of Kaplan, UWorld, to integrate throughout the basic science program to ensure your success on USMLE Step 1, to utilization of MBME examinations, to a curriculum that's comparable to what you expect at US schools, facilities that are outstanding, accreditation that's recognized by the US Department of Education, ECFMG certification, graduates that are licensed and practicing throughout the United States. I really think that we have a really quality academic program that will provide you with an avenue to achieve your goal of succeeding to become a future doctor. And so if this is your choice, we welcome you. We hope you apply soon. I would love to meet each and every one of you that's on this call. And then certainly if you apply and you're accepted, I will. So I hope that we've answered all your questions and provided you with the information you need to make a decision. So at that, have a great night. It was nice meeting you all, and hope to see you soon.
Thanks so much, President Ross. And with that, we'll share how you can get in contact with us, how you can follow us. Certainly, admissions at umhs-sk.net is a very easy way to get in contact with us by email. Phone numbers are on the website for all of us. It's very easy to find that. You can find us. We can find us on I know President Ross uses Facebook. I use Facebook. But most folks are on YouTube, and you can find this presentation that you're watching right now recorded and posted to YouTube within about 24 hours. But we're everywhere: Instagram, Twitter or X, TikTok, you name it. So thanks so much to everyone in our audience for being here. Thank you so much for joining us, learning about the University of Medicine and Health Sciences. And with that, again, my name is Sean Powers, Vice President for Admissions at UMHS. Wishing you a good evening. Thanks so much for being here.